Welcome to motor development series. So previously we discussed about the motor development is divided into gross motor and fine motor. Previously we discussed about the gross motor development, where in gross motor development, neck control, rolling, sitting, standing and walking. Today we are going to discuss about the fine motor development. What are the things in fine motor development? It is called as a arm and hand control. What is arm and hand control means? The child is reaching for toys and grasping and holding and releasing. These skills are called as a arm and hand control. In next slides, we are going to discuss about what age the child is going to develop these skills. At 0 to 2 months, initially the child fists are closed. It is a strong reflex. It is normal. Sometimes its random movements will be present. In this picture, you can see that in first picture, you can see that the child is holding fist tightly. And whenever you are going to keep your finger from this side, the child is going to hold for some time. Random movements, whenever the child is in awake and alert, the child is opening their hands randomly. 0 to 3 months, the child hands fists are going to slowly open. The children are trying to bring hands towards mouth, and sometimes the children are going to see their hands. Whenever they are going to close to the eyes, they are looking their hands. And 4 months, by end of 4 months, the child tries to reach for the toys intentionally, but sometimes the child is not able to hold for toys. Whenever you are going to keep some toy, the child is going to hold for some time, not for most of the time. By 4 months, the child hands fists are mostly open. Sometimes it may be tight. By end of 5 months, the child reach is increases. So whenever the child is see the toy, the child tries to reach for the toys. And by holding the toy, the child tries to bring to the mouth. And if you give the larger objects, you see in the third picture, if you give the larger objects, the child tries to hold with both hands and fists are open. By end of 6 months, the child hold objects of a rattle. Whenever you are going to give the toy, child holds objects and tries to transfer from one hand to another hand. He knows that if you give a rattle, the child tries to move the rattle, so sound will come. And here you can see in the third picture, the child tries to hold object with whole hand. By 7 months, the child gets better control in reaching for the toys. Whenever you are going to give some toy or rattle, the child tries to reach for the toy. It's a child, whenever you are going to give a rattle, the child tries to play in a manner by shaking and banging the toys. By end of 7 months, the child tries to use their fingers more. The smaller objects, if you give a smaller object, the child tries to use their fingers. By 8th month, the child tries to hold with fingers, like moving like this, and tries to hold. bigger objects, if you give bigger objects like in this picture, you can see the stackings and all things, the child easily hold for the toys. By 8 months, the eye-hand coordination improves. The child reaches for objects very easily. 9 months, developing a pincer grasp. Pincer grasp means by using the thumb and fingers. By using these fingers, the child tries to reach for smaller objects without any. Sometimes the child may miss, but most of the time the child able to hold toys with pincer grasp. 10 months, pincer grasp is improved. The child tries to hold the teeny objects and try to bring to the mouth. 10 months, the child releases objects whenever whatever objects child is holding, releases voluntarily. If you tell the child to put the toys in that one, the child tries to put it. By 11 months, the child is having a better finger control. Here you can see that mature pincer grasp by 12 months. The whatever tiny objects are there, if you give some part of idli, the child tries to take and bring to the mouth. By end of 12 months, the child able to understand by pointing. So child may even show by pointing. Uses both hands and tries to feed himself. If you give some cup also, like feeding cup, the child tries to bring to the mouth. There are red flags. Here you can see that if the child fist is tight by after 3 months also, the child is not able to reach for the toys and holding fist tightly. So we should consult pediatrician and our early interventionist. No reaching by 5 months. Whenever you are going to give rattle, the child not able to reach for the toys. No transfer from one hand to one hand by 6 to 7 months. Pincer grasp like thumb and finger. If the child not able to hold objects with thumb and fingers, you need to consult pediatrician or consult early interventionist. Simple summary about fine motor development: reaching, grasping and holding. 0 to 3 months, it's a reflex stage where the child fists are tight. 4 to 6 months, the child try to reach and grasp for the toys. 7 to 9 months, eye-hand coordination improves. So whatever toy you are going to give, the child tries to reach for the toys. By 10 to 12 months, the child able to control their hands and reach for the hold for the tiny objects also, tries to take and try to take to the mouth. Thank you.